I'm pleased to highlight Section 203 of the Preserving Telehealth Hospital and Ambulance Access Act, which is reflective of my good friend Dr. Winstrup's legislation, H.R. 1666, the Protecting Access to Ground Ambulance Medical Services Act. In rural areas throughout the country, including in my district, which covers 21 counties across central and northwest Illinois, access to life-saving emergency services is essential to protecting the health and safety of our communities. Rural EMS providers are faced with greater physical distances when responding to calls, difficulty recruiting a qualified workforce, and higher fixed costs over a lower volume of service. During my time in Congress, I've had the great pleasure of working with organizations such as Superior Air-Ground Ambulance Services, the Illinois State Ambulance Association, and Advanced Medical Transport, which all continue to tirelessly serve my constituents and all Illinoisans on a daily basis despite limited resources. As a member of the EMS caucus in Congress, I personally recognize how their critical work significantly improves outcomes and saves lives. As a proud co-sponsor of H.R. 1666, this section would extend Medicare add-on payments for ambulance services in urban, rural, and super rural areas through fiscal year 2025. Years of below-cost Medicare reimbursement have hampered efforts by ambulance services to hire staff, update equipment, and continue to provide life-saving services in their communities. Many ambulance service providers have closed or been forced to lengthen response times because of the stresses on their systems. This provision will help preserve access to critical 911 emergency and urgent inter-facility ground ambulance services. It's vital that we continue to support them. I urge my colleagues to support this legislation, and I yield back.